Good morning. I'm Charlita Tavares, the CEO of Primary One Health, and welcome to our quarterly Community Health Advocacy Breakfast Forum. And this morning's topic is housing. Most of us have paid attention to what's going on in the housing market. Certainly, the prices of housing have gone up exponentially, and the availability of housing that meets the needs of all of our residents has not kept up with the demand. We have many residents that do not have the ability to pay for the housing that's available. And we're trying desperately here in Central Ohio to develop more affordable or workforce housing for those that are with no income, those with marginalized income, and those who are middle income residents of our community. Primary One Health really wants to focus in on the social determinants of health. And one of those social determinants that impact the health and well-being of residents is housing. We've got 4 speakers this morning who are going to share different aspects of housing, whether we're talking about development of affordable or workforce housing, whether we're talking about housing for special populations, vulnerable populations, whether we're talking about single family housing, the full gamut. And then we're going to evicted from their housing. We generally have our community health advocacy breakfast forums at different locations, primarily those restaurants or businesses that are owned by racial, ethnic, and women-owned businesses, so we can provide an opportunity for individuals to share their business, their venue with the broader community. We do that purposefully because we want to grow those small minority and female-owned businesses in our community. And then we also want to share the assets of our community. However, COVID-19 has provided a difficult time for us to go to various venues. Many are not open as frequently as they were in the past, and many don't have the staff to staff on a Saturday morning. So we are at the Whitehall Library on East Broad Street, and we're happy that our library systems are open for our residents. Again, that's another social determinant of health, education. We are here, and catering this morning is provided by Primary One Health, and the proprietor is our own Christine Stein. Chris has provided all the snacks, breakfast foods this morning, so we want to thank you, Chris. I am going to get started with our first speaker. Our first speaker is Sonia Nelson. She's the Vice President of Resident Initiatives at the Columbus Metropolitan Housing Authority, CMHA. As the management lead for the Resident Initiatives Department, her team provides a connection to resources and supports that enable residents to be safe, stable, and economically mobile. I'm going to let her finish out her introduction, and we're going to let her come on up to the podium now and provide her presentation. Sonia? Tap. Do I need to worry about the video? Okay, good morning, everyone. Thank you, Mr. Tavares and Primary One Health, for having me today. I really appreciate the opportunity. In regards to, I think there's a personal resume and a professional resume, and I think during this time, I'm honored to share my professional part, but I think the thing that's most applicable to today is my personal. My connection with CMHA started way before I actually became employed there. I used to receive the Housing Choice Voucher from CMHA. By having that voucher, it allowed me to be able to go to school and work part-time and work my career up until where I am at today. And so when we talk about the ability of what housing stabilization can provide,
I'm not just talking about it because I know what it can do. I'm actually an example of what it could do. So, so that is the extent, I think, of my personal relationship and why I think housing is so important and why I think having additional supports to help residents continue to achieve economic self-sufficiency is valuable. So let's talk about CMHA. So CMHA's mission is to provide affordable housing through partnerships to develop, renovate, and maintain housing, promote neighborhood revitalization, and assist residents in accessing needed social services. And I think the way that people think of CMHA previously was that they're the administrator of public housing. And we're actually going through a transition where by the end of this year or early next year, we will be out of public housing. And just as that part is renovating for CMHA, it also is an example of how housing looks for CMHA. Public housing was not sustainable. There was a lot of things that you could talk about how public housing didn't work. By CMHA having the ability to transform the way that they provide and finance housing, allows housing to be more affordable and changes it to a way to its housing of choice, not because of my income, I have to live here. And that's a great example to be in. And so as we continue to expand in areas outside of the urban core, people are starting to see a little bit different of what CMHA housing actually looks like. And I think that's important as we start to see and look at what other options housing can be. CMHA's jurisdiction serves all of Franklin County. So we have a total population we serve of over 31,000 residents, a little bit of almost 13,000 households. That is broken down by those that actually live in our CMHA communities, that CMHA owns, which is around about 3,000 households, 3,000 individuals. And then another about 10,000 households that have a voucher. So we'll talk about the differences between CMHA's different housing subsidies in a second. So here's CMHA's portfolio just in the units that CMHA owns. And so we have over 10,000 residents in those units. They're about 4,500 units. CMHA owns almost 39, and it's growing, 39 communities across Franklin County. And so when you think you know CMHA, when you start to look at those different communities and you start to look at what the amenities are and how nice they look on the inside, it completely changes your mind on what CMHA is. At the bottom of the screen, you see the different types of housing. So we have workforce housing, we have housing that is, we still have some project-based vouchers, which are vouchers that are connected to an actual unit. Some of those CMHA has to subsidize the units in their own housing community. Some of those CMHA have leased out to property owners in the community so that they can have that affordability there. And then we move on up until market rate and mixed income. The most important thing about this spectrum of housing is the connection. So you can have someone that has zero income receive a subsidy from CMHA, and they will continue to increase in their financial income. And as their income grows, they can continue to stay within CMHA's housing portfolio. They can move up into our workforce units. They can move into our mixed income units. They can then move into our market rate units. Having that spectrum of housing allows CMHA to be there and support our residents each and every step of the way. So as I mentioned before, we have two main ways that we provide housing. One is through the Housing Choice Voucher, and the other is through our CMHA communities. Most of the time when people think about housing from CMHA and they're in need of housing, they think about the voucher. And that voucher, a tenant-based voucher, is a voucher that an individual can take and they can apply it to any unit across Franklin County. Those are valuable, but we know that while they offer a sense of choice, that there are very many things that's in the environment today that make it hard for for individuals that have the voucher to apply it to a unit. We have NIMBYism, not in my backyard, where people have stigma about those that have CMHA vouchers, and they have ridiculous requirements in order to be able to rent those places with the voucher, knowing that those that have the voucher wouldn't be able to participate or live in their apartments. And so knowing that even having the lack of affordable housing, the vouchers can only cover so much in rent. So when we have a lack of affordable housing, that means the rent is higher than what the voucher can actually cover. So there are people that have this golden ticket to be able to have affordable housing, but there's not enough affordable housing units for them to actually apply. That is a huge loss on such a foundational program. So CMHA said one of the reasons for their aggressive development plan around their communities is because if you're recognizing if property managers and landlords are having an issue about letting our residents stay there, well, we'll just have an aggressive development plan and let everybody come live at our place. And so, CMHA has a plan to increase their portfolio of at least 500 units of housing every year. And that is huge. So that is 500 units of housing that does not have this high stipulation of being able to be included into the program, and allows people to actually have second or third housing chances. So if you look on CMHA's website and you go to CMHA, go to other housing opportunities in our communities, you will see a list of CMHA housing communities. Individuals that are interested in living at one of CMHA housing communities should contact the housing community there, and they will let you know what is the specific requirement to get on their wait list. Frequently asked questions. So there's a lot of questions, a lot of assumptions around CMHA's program. So we're going to cover just a couple of them. One of them is, what is subsidized housing? And for some reason, sometimes people think subsidized housing means subpar, and that's not the case. Subsidized just means the rent is portioned to the individual's income. So for our subsidy, the rent is 30% of the individual's income. Another common misconception with CMHA is our background check policy. Some people assume that if you have a felony conviction, that automatically bars you from being able to receive housing or receiving a subsidy from CMHA. And that is far from the truth. CMHA has been recognized nationally of having one of the most appropriate background check policies in the country. And it has recently just been revised to even probably be the best. So there's only certain convictions that would allow you to not be eligible to live in CMHA housing. And besides being a tier 3 registered sex offender, or being convicted of producing drugs on a public housing site or a federally owned site, those are the only two convictions that you will forever be barred from being in CMHA housing. Everything else is time limited. It's 3 to 5 years. And CMHA's board recently approved a change to where even that can be appealed, where individuals can demonstrate what they have done from their conviction, so that decision will allow them to be able to be waived so they can receive housing. Prior evictions, we all understand, especially in today's economy, things happen. And so sometimes you need a second or third chance. And so prior evictions is not an immediate no for CMHA. So we only look at it if you were evicted from federally subsidized housing or from the housing program, the Housing Choice Voucher Program. And that is only for a limited amount of time. But other evictions that do not include that stipulation, we don't count. We don't count those. And I think one of the biggest and unfortunate misconceptions is our Housing Choice Voucher lottery program. Most people think it's a wait list. So traditionally, before we switched over to a lottery program, you used to be number 214, and you knew as when 213 was housed that you would be up next. And we don't have that system anymore. Now we have a lottery system. That lottery system allows us to be able to serve those that have higher needs first. So each application comes in, they are scored, and you can achieve up to 21 points. There's a lottery based off of the number there's a lottery of those that have 21 points or 20 points. And then those individuals are selected to be put on the wait list and contacted so that they can actually start the process to receive their voucher. So unfortunately, it is not a guaranteed time where you know that once X amount of people are served. But the good thing to know is that we're serving those that have the immediate need, the most severe need first. But again, want to hit on our housing communities, those that have, they have their own site-based wait lists. So just want to hit real quick on CMHA's Resident Initiatives Department. I think it's a great department, not just because I lead it, but we create sustainable partnerships and programs to help embody choice, empowerment, and inclusion and to support our residents. Some of our themes of our work include those very important words. We use a tone of empowerment. We like to provide programs that are of choice, and we have inclusion where our residents are included in everything that we do. The RISE Center is a HUD designated Envision Center that serves as a one-stop shop for all of our residents' needs. Individuals can come into the RISE Center, create a RISE plan. They're connected to supports to create a housing stability foundation, and then they can identify their goals and we help them achieve them. The focus areas of the RISE Center is around economic empowerment, adult and youth education, health and wellness, and character and leadership. Our service coordination model is as diverse as our residents. And so we know not everybody wants to receive supports in the same way. So we have a partnership with Central Ohio Pathways Hub that provides more in-depth one-on-one hand-holding support. We also have on-site coordinators that are available to help our residents if they have a question and need assistance right away. We have a partnership with Aunt Bertha for those that say, I don't need hand-holding. I know what I need. I just need to know where I can go and get it. So they can search on Aunt Bertha and make a self-referral there. And we have one touch type of support with our legal aid and Columbus Financial Navigators. Again, thank you for the opportunity to share about CMHA and how we support housing stability and provide a foundation for our residents to achieve economic self-sufficiency. Thank you.
Thank you very much, Sonia, for your presentation, and thank you for dispelling some of the myths that folks have about CMHA and CMHA's programs and housing. We're going to move on to our next presenter. And I do want to share before she comes up that Primary One Health is a partner with Columbus Metropolitan Housing Authority on several initiatives, but most of our work with them is providing health and wellness programs to the residents, not only of Rosewind and the 43211 community, but also the communities around Columbus and Franklin County. So we want to thank them for their partnership. The next speaker that I have is really going to zero in on specialized housing for populations that are very vulnerable. Samantha Schuler, known as Sam, is the Chief Executive Officer for the Community Housing Network, and it's a nonprofit permanent supportive housing company based in Franklin County. CHN, Community Housing Network, serves the Franklin County Alcohol, Drug, and Mental Health Board, as well as the Community Shelter Board, and really invest in properties and people, particularly those with substance use disorders, mental health disorders, and those who are homeless in our community. I'm going to have Sam come up and share more about her background, but she's really going to zero in on housing needs of those with special needs or those with service supports. Sam, come on up. And in addition, she is a board member of Primary One Health.
Awesome. Well, good morning, everyone, and thank you so much to Primary One Health for both having me here today and for hosting this event. It's fantastic, and of course, my favorite topic to speak about is housing, because that's what I do, and I've spent much of my career doing that. I have been with Community Housing Network since 2003. I started out doing real estate development work with them, and then I became the CEO in 2015. And so you how long I've been there, I'm very passionate about it, and really love what I do. And so it's a privilege to be here today to share a little bit with you. As Charlita said, we supply or provide permanent supportive housing here in Central Ohio. Permanent supportive housing is it's a nationally recognized model, evidence-based, that basically targets people who are vulnerable. In our case, we provide our housing to people who have mental health issues and addiction disorders and who've had experience with homelessness. And it combines that housing with supportive services. So basically, the housing is part of that service package. It provides the stability that people need to really focus on their health. And then we make sure there's lots of support to go along with that to help them not just live, but to thrive and to really live a meaningful life. And that can be supportive services on site. Sometimes it's mobile services, but it's anything that they need to help them first just be stable, second, recover, and then eventually thrive. So we provide life skills, transportation, mental health and addiction services, family reunification, employment opportunities, benefit opportunities, all of those things. And so what we've found is this model nationally, locally, we found the same thing. It's incredibly successful. Over the last 4 years, we've served over 2,000 people, and 96% of them have maintained their housing. And of those who've left, 98% have not returned to homelessness. And so we're very proud of those outcomes, but really the work gets done by the folks that we serve, because they're very resilient people. They've been through things that I can't imagine, and I would probably have given up long before they did. And so it's always an honor to meet them and really hear their stories and how resilient they are. And it's exciting when we can help them take the advantage of the opportunities we offer and get better. I often get asked by people in the community how they know somebody, either a family member or they notice someone in their community who has a mental health or addiction issue or is homeless or maybe at risk. You know, what do I do in that situation? And so I want to just say, if you know somebody who is experiencing homelessness or is even at risk, and at risk means they're in a situation where their housing isn't safe. And that often happens with people who, for example, are experiencing domestic violence or maybe in a family situation that isn't good for them. You can reach out to the Community Shelter Board. They have services that both try to help prevent you from becoming homeless, but also if you are homeless, to help find you housing. If you have a family member with mental health or addiction issues, also you can reach out to the Franklin County ADAMH board. And then just in general, for folks who may know someone struggling with a housing issue, there is a website that basically tries to be a hub for the rental assistance that's available in our community. And it's for tenants and landlords. It's called rentful614.com. And it's a good place to start because it will then help you know all of the agencies out there. There's so many doing great work, and that's a way to connect. So I always want to point that out. I also will share that and a lot of people sort of have two different sometimes reactions to those that we serve. Sometimes it's immediately like, I have someone in my life like that. How can I get them help? And sometimes it's, I don't know anyone like that. Those people aren't like me. And that's where I think one of the things Charlita wanted me to talk about are sort of the myths around the people that we serve. 1 in 5 adults will have a mental health issue in their life. And 1 in 10 youth will have a major depression period in their life, and 1 in 25 adults will have a severe and persistent mental illness like schizophrenia, bipolar disorder, or major depression. So yes, you do know people like this in your life. And in fact, the difference between the folks that you may know and the people that we serve is that the treatment works when you have great support systems and you can, one, be diagnosed. That helps prevent you from having major issues. You can be treated, or even if you're not diagnosed early, treatment can come in and it works. People get better, they thrive. And so the people that you know have gotten that help. They've had those support systems. The people that end up needing our services, it's because they didn't have that support system. Something along the way interrupted that. So many of the people that we serve have had incredibly traumatic upbringings. So many of them grew up without means, and they did not have the family support, let alone income support, to help diagnose, prevent, and get recovery. And that over time spirals and spirals and spirals until you're in a situation where you need our support and our help, because that connection for you is there. But you do know the folks. The difference is just, I think the luck of having support or not support in your life at the right time. And so I just wanted to share that. I'm often asked, how can I help? And of course, please help people who are in need by connecting them with these services. But also, when these types of housings are proposed in your neighborhoods, we get a lot of pushback from people who don't want it in their neighborhoods. And so if you can talk to your fellow community members about how important this type of housing is, that's always very helpful. I also would say that there's a lot of local efforts to try to make renting affordable housing not so difficult. So things like, I'm trying to think what they call it. It's a source of income. So in other words, you cannot deny somebody housing as a landlord just because they have a voucher, or pay to stay. In other words, let's not evict people if they're 1 day late on their rent. Those are things that you could support in your local community. And then there's a lot of stimulus money or ARPA money that's been awarded, and we're working through what do we do with that as a community, and promoting use of that for housing. I think is incredibly important. In Franklin County, I think 54,000 people are paying over 50% of their income towards rent. And to be affordable, housing really needs to be 30% of your income towards rent. We have 40 new people moving into our county every day, and it's estimated we need to build 20,000 new units to meet all the people who will be here by 2050. And we're not even close to that a year. I don't even think we're at 10,000 new housing units a year. So what's happening is we have a lot of people competing for a very small amount of housing. And so people at the lower income scales have a smaller and smaller place to go for housing. And even when they find it, it's taking up a huge part of their income. And it's an incredibly it's at a crisis level already, I believe, in our county. And so to the extent that you can support any effort to put more funding into affordable housing, it would be helpful to our community, not just those who end up homeless, but our entire community will be impacted by this because everybody needs housing. So with that, I think I hope we've covered everything for everyone, and I really appreciate your time. Thank you.
Very much. Thank you very much, Sam. It's really important that we understand some of the strategies that we as individuals can take in order to help our community residents that may not have the affordable housing that they need. And one of the points that Sam made is that we need to advocate as individuals for more dollars going to housing so that we can support the needs of our community residents. We don't want to have more people out on the street living on the land or freezing to death in this kind of climate because there is no housing. So as much as we can, we should advocate for more workforce and affordable housing and specialized housing, and then to work with our residents, our neighbors and friends within communities, not to be negative or stigmatize individuals because they have a substance use disorder, formerly homeless, mental health disorder, or developmental disabilities, because all of those populations, or if they're economically challenged, all of those populations are stigmatized and communities are saying, no, I don't want them living near me. So we've got to be the advocates for our brothers and sisters in the community because all of us have someone who's been touched by these issues. Our next presenter is Robert, otherwise known as Bo Chilton, who is the CEO of Impact Community Action, which is our community action agency here in Franklin County. It's one of the leading human service agencies fighting poverty in Franklin County. It's got an annual budget of over $10 million and an agency budget of over $51 million. Bo has been the CEO for a few years. He's a longtime member of his fraternity, Alpha Phi Alpha. I will share that, Bo. And he and I have a special relationship because he was my former legislative assistant when I was on Columbus City Council. So, Bo, if you would come forth.
All right. Well, good morning, everyone, and thank you for the opportunity to present. Thank you, Charlita. As you share, we have a very special relationship. I credit Charlita with being the one who really introduced me to the city of Columbus, how this city moves and operates, and helped me with a new career trajectory. Prior to that, I was an educator, and having worked in middle school, high school, and at the higher education level. And so I still consider myself an educator in a classroom without walls. Impact Community Action is part of a national network of over 1,100 community actions across the nation. And there are 48 here in the state of Ohio. Collectively, we serve all 88 counties. We are the designated community action agency for Franklin County. We serve people who are at 80% of AMI or less. For a family of four, that's about $67,350. Oh, wait a minute. We were founded in 1964 as part of Lyndon B. Johnson's vision for a great society and his declaration of the war on poverty. Primary One is also a part of that same movement as a federally qualified healthcare system. Out of that also came legal aid, Head Start, and other programs. And so we're all part of that vision for a great society and the declaration of the war on poverty. We are a private nonprofit, and one of the unique things about our board is that we have a tripartite board made up of 21 members, 7 members who are from the private sector, which are traditionally where a lot of nonprofits mine their candidates and board members. We also have 7 who are elected officials, or they have a designee who sits on as part of the public sector. And then we have 7 who are low-income people themselves or work for organizations that serve low-income people. And so it is a very different mixture and conversation when you have people who have actually gone through your programs, who actually sit on the governing board and have a say in the shape and future direction of your organization. We served over 30,000 families annually who are at the 80% of AMI. And we have over 150 employees. So in the introduction, we talked about our annual budget. Traditionally, we have been at about $10 million. In 2019, we had a budget of about $10 million. However, because of the pandemic, we have been a recipient of a lot of federal dollars that have come through, passed through to the state as well as to the city and county. And so that is where we have received over the past 2 years, almost $90 million. And so that is what has contributed to the extreme growth of our budget. Again, 90% of those dollars are just passed through. So they're going directly to clients for client assistance. So when we talk about our role in the housing space, particularly as a social determinant of health, one of the things that we're trying to do really from an environmental justice standpoint is make sure that people have safe, decent housing and that it is lead safe. So we're checking for those. We monitor to make sure there's no carbon monoxide and things of that nature. And we do this through our weatherization program. So we have a number of programs focused on energy efficiency. So with our home weatherization assistance program, we're able to weatherize people's homes. That means cleaning and tuning furnaces, replacing those furnaces if necessary. It's putting insulation in the walls if they're not already there, making sure that the attics are properly insulated, that the windows are properly sealed and there's no air coming into the house. And so we want to keep people warmer in the winter and cooler in the summer. And on average, we're able to help people save about 28% on their utility bills. And we teach about energy conservation. This is a space that we're going to continue to grow in. We are part of the City of Columbus's Climate Action Plan. And the city has now worked with AEP to do the aggregation of the utilities for electric. And that has created new opportunities. We'll be doing some workforce in the green economy, including solar panel installation. And now that we have all of these electric vehicles and it's been electrified, we will also be teaching people how to repair and maintain those charging stations and take care of those electric vehicles. So that's something I'm very excited about with our future and the green jobs that will come out of that. We also have energy efficiency advocates who go around and teach people in their neighborhoods. We hire people from those neighborhoods to then go and teach their neighbors about energy conservation and the programs that they can sign up for through AEP and Columbia Gas to be able to save energy. I want to talk a little bit about the emergency rent assistance program. As we know, our community has gone through a lot through this pandemic. We wanted to make sure that we kept people safe in their homes. And so when we first heard at Impact that we would be receiving additional dollars through our community service block grant, an additional $3 million, the first thing I thought of is, okay, we need to dedicate at least $1 million of this towards rent assistance, and we need to start partnering with other agencies to figure out what resources they have so that we can take more of a collective impact approach and address the issue systemically. This is long before I knew that all of the other federal dollars would come. So this was early in 2020 when we got the word, and then we would start planning for working with our partners. We created an earned revenue model working with a lot of the smaller nonprofits who were impacted because they could not do their traditional fundraising. So we created an earned revenue model in which we said, okay, we're going to give $200 for every application that is processed by one of our partners. And so theoretically, if they're processing 25 applications a week, they can earn revenue at $5,000. When they take away their operating costs for the staff member and space costs, let's say it's $1,000 a week, then that contributed $4,000 to their unrestricted flexible funding. So that was something that we wanted to try and do. And so as we started putting that proposal out there, then we found out from the city and others, when we put out a proposal saying, hey, we want to raise another 500,000, to create this hope fund is what we called it. They then said, well, can you take more than 500? I said, sure. And then that's when we started finding out about all of the different funding that was coming to our community. And I just want to highlight some of that because there's a lot of misinformation, I think, about how the money is getting out and, how much remains. And so there's actually been three different legislative acts that have contributed money federally. So the first one was the Coronavirus Aid, Relief, and Economic Security Act, CARES, which was signed into law March 27th of 2020. It provided $17 billion in rent and mortgage assistance. So that was the first program. We were able to help people both with the rent and with the mortgages. And so it was extended twice because it was kind of slow getting out there. Again, our community action network of 48 agencies was tapped to distribute those funds. Again, we were a network that touches all 88 counties. But I can tell you, our state, we were not fully prepared for this program because we did not have a statewide portal where people could apply online and gain access. And so what it meant was each of us individually had to come up with our own system. And so we were able to pivot and do that. Then the Consolidated Appropriations Act was passed. Many people refer to this as ERA-1, Emergency Rent Assistance 1, as is so-called by the Department of Treasury. That was signed in December 27, 2020, as we started to understand that this pandemic was going to be here for a while. At that particular, we were still struggling to find a vaccine. And so there was another tranche of money that was passed as part of the Consolidated Appropriations Act. However, it was $25 billion, but they shifted the focus to rent only. The thought was that mortgage holders would need to work with their banks to get forbearance, to get payment extensions and things of that nature. That is a program that we are currently operating. It goes through September 30th of 2022. And we still have about $40 million to be able to distribute between now and then. And there is, with this program, we are able to pay 12 months of arrearages and 3 months future rent. The key there with the 3 months future rent is really significant. And I'm going to be an advocate for whatever emergency rent assistance we have going forward after the federal dollars end. Having that ability to pay future rent is a key to helping people achieve self-sufficiency. With that, many people who are stuck in 2 or 3 part-time jobs and can't seem to get ahead, we often say, well, the solution is, get more education, get training and credentials so that you can get a better paying job and take care of your family. Well, when you're in survival mode, how do you do that? So with this program, what we've been able to do is to say to people, hey, we provide holistic wraparound services, workforce development, financial literacy, computer literacy, all of these programs. We also provide a stipend while you're going through our training programs. You can afford to step back and get the training. For instance, we have a medical assistant program that's 15 weeks. We've been channeling some people to primary one, as well as our other healthcare systems. So our first cohort, we had 15, all 15 of them got jobs even before they graduated. So that just tells you the tremendous need that is in our community. But with this emergency rent assistance, when we can say to people, hey, we're going to take care of your 3 months future rent. We're going to remove all of the other employment barriers that you may have, whether it's transportation and childcare, so that you can focus on getting this credential and then getting to a family sustaining wage. And so that is significant. And then the next tranche of money was passed by the American Rescue Plan. It is referred to as ERA2, and that is a program that is just now starting. The dollars can be used through December of 2025. However, I can tell you most of what I've heard is that they want to try and stimulate our economy, continue to stimulate it, and try and spend down those dollars before the end of 2023. This just gives you a little bit of information. I'm not sure if I can move this box because you can't see some of this. Let's see if I could.
See the little one line over there.
The one line. Oh, yeah.
There you go.
Okay.
Then you should be able to move that.
Okay. Great. There we go. This just gives you a quick overview of what's been distributed. And the reason why I talked about the different levels of funding is because there's been reports from news outlets who looked at the state ERA dollars, and what they saw is that only 13% had been distributed. And then there was a lot of alarm, like, well, wait a minute, we got all of these people who need help and we're not spending the dollars. The reality is that we've had 3 different pots of money: the coronavirus funding, which has already been out there and distributed. We had the ERA1, and all of these have different expiring deadlines. So the thought was we're going to use the ones that expire first before we start tapping into the other dollars. The other piece of that is that both the city of Columbus and Franklin County received direct funding in addition to the state. So the news journals were only looking at the state ERA program. So what you can see is collectively between our program, our partners, the Stable Housing Initiative, Sam talked about Rentful 614 being a great website to check out so that you can see all of the partners who are providing assistance in Franklin County. But collectively, and this number is probably a little low at this point because we don't have all of the data from all of the partners. But what we do know is that we've served almost 30,000 customers since June of 2020 and distributed almost $70 million in rent assistance alone. And then when you combine it with the utility assistance, we have served over 37,000 people and distributed $73 million. Again, trying to keep people safe in their homes. One of our goals was we do not want to overwhelm our shelter system. We knew in the beginning that with this virus, that people who were in congregate living settings is a place where you will continue to see that spread. So we wanted to do our part to keep people safe and healthy. I will say this, I'm going to make a plea for those out there to really consider getting vaccinated. It was one thing in the beginning when I would ask my staff, myself and my staff would go to eviction court, which was moved to the convention center. It was a very surreal kind of experience when we first set up this rent assistance program down at the convention center, because this was in late May when we went down to visit and take a tour of the place. And this was right after the George Floyd's killing. And what we had here in Franklin County were armed guards and military and Humvees who were kind of directing traffic. So we went down to the convention center. I'm looking at these armed guards. We went into the convention center. There was all of these hospital beds because they were preparing for the overflow. And so that's what we were walking into, not knowing what's going on with this virus, and there's no vaccine in sight at that particular time. And so we're asking our staff to put themselves in harm's way to try and serve the community. And we did that. And we had people who came to court and divulged to us they were positive, but they were about to be kicked out and they had no other choice, so they came. And so that was a real exposure. Once we got the vaccine, I said, okay, finally, at least we can get to some sense of normalcy and we're not putting our staff in jeopardy, because I can tell you it's been a major pivot. It's been a lot of pressure. We've had a lot of turnover with staff. We've had some people who have tested positive. About a third of our emergency assistance staff ended up getting the virus. We would have to send people into quarantine. It's just been one thing after another. Once the vaccine came, I said, okay, finally we can get to a sense of normalcy. But now with the Omicron variant, it is even worse than before. And we are continuing to have issues with putting people into quarantine. So I really implore those who are not vaccinated to seriously consider, if not for yourself, then for the loved ones, or for those who are serving the most vulnerable, so that we can do what we need to do. So I'll get off my soapbox now. This is just a little bit of data about eviction filings. One of the misnomers is that we had an eviction moratorium and that people could not be put out. That is not necessarily true. What we had was, as you can see, the eviction filings continued. They did drop off during this moratorium, but what you had to do is you had to basically apply for the assistance. And if you applied for the assistance, then you were given some protections. So you could not be evicted for non-payment of rent. However, you still could be evicted for other things. If it was illegal activities and things of that nature, people were still able to be evicted. And then certainly once the moratorium ended here in Franklin County in July, the end of July of this year, we started to see a spike again in the filings. This just gives you a little bit of data about where are the zip codes in terms of rankings, where we're seeing most of the eviction filings. We use this data to then try and target those zip codes to make sure that that the people where we're seeing the most filings, we're also seeing the most applications. So if we see a lot of filings and we're not seeing applications, then we know that we need to do a targeted outreach to those zip codes. So I will end there, and
Thank you. We're going to take the questions at the end.
At the end,
if you
okay.
don't mind.
Perfect. Let me leave you with this phone number if you have questions, 252-2799. Thank you.
Thank you very much, Bo, and thank you, Impact Community Action. I'm proud of that young man. We have the next speaker is Nate Kaufman, and Nate is the Executive Director of the Ohio Community Development Corporation Association, Ohio CDC Association, which is a nonprofit trade association for community development corporations that work in our communities to revitalize them, whether they're rural or urban. And he's going to share more about the development corporations across the state of Ohio, here in Franklin County and Columbus, and some advocacy that we need to do as residents. And then after that, I'm going to introduce one of our special guests that's here today, and we'll take questions.
How's that look? Is that good? All right. Very well. Good morning, everyone. Thank you, Charlita and Primary One Health for having me here. I'm Nate Kaufman with the Ohio CDC Association. We're a membership organization of about 285 orgs, both rural and urban, predominantly urban, across the state that work to uplift their community. It's a bottom-up movement that is community development. We as the, I should be remiss to say that I actually have a board member here, and Mr. Bo Chilton. Good to see you, Bo. Our association, we don't do the heavy lifting that all of the folks in the field as practitioners do, but we exist to help build the capacity of our members. And we do that through a variety of different programs. And I'll mention a couple later on relative to Franklin County. And we also do a good deal of advocacy around affordable housing and other issues. But community development is, a broad movement that is, beyond housing, that encompasses everything from local food access economic development and community organizing and so forth, which I salute all of you for focusing on the social determinants of health. It's been in our sector, the community development sector, there has been increasing recognition and collaboration between community development and healthcare sectors, realizing that healthcare, or that health is not just healthcare, and that housing is one of those key, and I would say foundational elements of the social determinants of health. It is foundational to every metric of health and success and well-being. And would also point out that we have here in Columbus what many would say is a national model of a CDC and healthcare institution partnering, and CD for All People and Nationwide Children's Hospital along Parsons Avenue, and everything that they're doing to make a difference in their community. I'm going to echo much of what the three previous speakers said in terms of emphasizing that, yeah, we do have a growing affordable housing crisis in Franklin County and the country. And I don't want to be hyperbolic, but it is most definitely becoming more profound. Just to give you a couple of data points, the National Low Income Housing Coalition issues every year their Out of Reach report that tries to look at, well, how much of a wage does one need to achieve to live in an average two-bedroom apartment, market rate apartment. That wage for Franklin County is $19.83, which translates into $41,240 to afford that two-bedroom apartment, and that is the average. So you have many falling beneath that, which, as Sam and Bo and Sonia pointed out, have made things quite difficult. Another way to equate that is you would need to work as an individual 2.3 jobs at minimum wage to afford said apartment, which goes to show we have other fights on our hand where we need to raise wages so people can afford housing. And then lastly, to just show how affordable housing is resonating amongst the general public, just 2 days ago, Pew Charitable Trust came out with a nationwide, quite extensive survey on affordable housing and what the public feels about it. 49% said that the availability of affordable housing is a major problem, not just a problem. That is a major problem. So half of America, of our fellow citizens, are looking across their community and seeing that we are in crisis. To give you another sense of how that is increasing, that is a 10% increase in just the last 3 years. So we need to have strategic and resourceful investments in affordable housing at a local, state, and national level. I'm going to talk a little bit about advocacy and then with just a couple of announcements or promos, if you will, on other programs of note. Bo is doing an incredible job and his team of distributing emergency rental assistance for those that may be experiencing problems with their mortgage. There's a little known program being administered through the Ohio Housing Finance Agency, and it is Save the Dream program. They provide mortgage relief for those who have found themselves in a difficult position over the last couple of years. That website is savethedream.ohiohome.org, savethedream.ohiohome.org. So there is most certainly the demand and the need is predominantly on the rental assistance side, but for those who are experiencing mortgage relief, there is a resource, mortgage relief issues, there is a resource with OFA. A couple notes of programs. I say we're not practitioners, but we provide resources to our members, and we do offer a few housing programs that I did want to inform you all of. First is in the last state budget, we were able to get funding for what we call the Main Street Job Recovery Program, which is high dollar grants to nonprofits to connect job creation and residential revitalization. We just found out, we didn't advocate for that to run the program, but we just found out the Department of Development wants us to run it. So nonprofits will be seeing that RFP come out in the next few weeks. And we're also concurrently trying to increase our budget amount with the state ARPA allocation. Secondly, we are partnered with ETSS, Ethiopian Tawahedo. I always mess it up. Tawahedo Social Services, ETSS, with a refugee individual development account program. You know, once again, home ownership is not for everyone. You know, renting is great. Homeowner, you know, it's all each individual's circumstance. So we have an individual development account for refugees in Franklin County where they can save, receive intensive financial education, and at the end, purchase an asset. And one of the eligible expenditures is a first-time home. And so ETSS will have that resource for over the next couple of years. And then thirdly, we operate the state's largest AmeriCorps Vista program, which I describe as a domestic Peace Corps, if you will. I know CMHA has hosted some of our Vistas before, and Impact as well. And so we just come mid to late February, we have many housing focused vistas in Franklin County and across the state that we'll be posting those positions on our website at ohiocdc.org. And so we're always looking for folks who want to serve their community, to help build the capacity of a variety of different housing programs, to check out our website, ohiocdc.org, and see if AmeriCorps Vista may be right for you. So lastly, you know, a big part of my job is advocacy. And boy, there's just so much going on over the last couple of years. And I want to give you just an update on a couple of topical examples. First, on the federal side, we hear all this discussion about Build Back Better, and you know, it started off at $3.5 trillion, and then it's 1.75 trillion was promised, and there was going to be within that $150 billion in affordable housing investments across the entire spectrum, from vouchers to neighborhood revitalization to workforce housing, et cetera. That is at risk, as I'm sure many of you have seen, in that they are now going to further reduce Build Back Better and have a smaller package with some programs such as maybe the child tax credit, universal pre-K, and it is not looking good at the moment for housing to be a part of that. If housing is not a part of that, it is DOA, because then any of these housing programs that I spoke of would need to meet the 60-vote filibuster, which we all know, and this is not a partisan statement, that ain't gonna happen. So it is, you know, in terms of an advocacy announcement, I would say is important, you know, to let your members of Congress, and particularly Senator Brown and Senator Portman, and we do know that Senator Brown is very supportive of having the housing investments in the broader package. But if that doesn't make it in there, it is not good news for what would be transformational investments in housing across the country. At the state level, there is a plan that is being considered that does have a great deal of momentum for the state ARPA, American Rescue Plan Act allocation. There are too many acronyms in community development and government, I suppose, period. And that also is a broad spectrum of housing supports, from permanent supportive housing is a big chunk of it, to home repair, to gap financing for affordable housing development. That is getting a lot of positive attention in the governor's office and the State House. The Coalition on Housing and Homelessness in Ohio, Co-Ohio, is leading that effort. And so we're very hopeful that at the end of the day, the state is going to take some of their ARPA allocations and invest that. And the other that we are working on in partnership with Co-Ohio is we are working on a bill, we'll get into, called House Bill 237, that will hopefully increase the state's primary affordable housing resource, which is the Ohio Housing Trust Fund. We're trying to increase recording fees just a little bit, not any burden on anyone. That would in turn create a lot of resource for much needed affordable housing. And lastly is, local government. I'm going to stare at the council person here. Sorry. Is there both the city and the county with the local ARPA, American Rescue Plan Act funds, have, I don't know, somewhere in the neighborhood combined, I think, of $500 million to allocate and to invest in the community. And certainly with everything we've been talking about here this morning, with absolutely growing affordable housing needs, that I'm sure the city and the county both are looking at investing a sizable amount of that into affordable housing, because it is certainly much needed. And on that note, I'd give a shout out to I know many of you, all of you, I'm sure, are involved, the Affordable Housing Alliance of Central Ohio, and Carly Booz, that is kind of working with all of you to make that happen. And certainly hope at the end of the day that we do see our local governments invest in affordable housing. So with that, thank you. And yeah.
Thank you very much. And before we take questions from our audience, I do want to introduce the council member who was alluded to a minute ago, Council Member Nick Bankston, who chairs the Economic Development, Small and Minority Business and Technology Committees. And we want to invite him up to share some comments, especially on the topic of housing, but anything that you want to share, we'll take questions from there.
Well, thank you, Nate, for putting me on the spot. I appreciate it, which is typical of Nate. So I've been to the Ohio CDC conference many times, and so I appreciate all the work that you're doing. And good to see so many partners. But before I start my comments, I want to make sure that I pay homage. It is not missed on me that I am at council and where I am because I stand on the shoulder of giants who came before me. So she's Madam CEO today, but definitely want to pay homage to Senator Tavares and one of the best council members in the city's history, former council member Tavares. And also one of the baddest senators in the state of Ohio history is here as well, former State Senator Ray Miller. Also want to pay homage to you as well. So I'll be before you really briefly. I do not share housing, but it is deeply passion of mine, and because one, it's personal. So I remember it was back in 2001 or so where my parents had to file bankruptcy, and we found ourselves as a family homeless, right? And so a family of four, we went to go live with my grandmother in North Linden in her 3-bedroom Cape Cod, where we slept in the upstairs attic. But also in that house was my uncle, his girlfriend, and her son, right? And so this issue around housing is really critical. And when we talk about the social determinants of health, it's really about the systemic determinants of health, right? We know that housing, and particularly in the African-American community, it was systems and systematic policies that were put in place that have caused what we see today. And so we need to be able to break those down. I believe that housing is the key. It is the foundation to how we combat these social determinants of health that we talk about. I know because of the work that I do, I'm also serve as the president and CEO at Gladden Community House, where we work every single day to keep folks in their homes. That if you are stable in your house, all the other things fall into line so much easier. You can keep that good paying job. You can make sure that your kids have a stable education because they're not bouncing around from school to school. You can have a sense of community and safety because you know the folks around you and you're able to be in connection with them. So this is the key, and we have to make an investment. This is not about giving a handout to folks who don't deserve it. This is about a human rights issue. Housing is a human right and everyone should have it. But the issue I also want to make sure that we are talking about at the city level is not simply about the affordability of housing, but about the quality. It does not do us any good that folks can afford their rent, but they're living in subpar housing. That is a social determinant of health, right? The environment that you live in. And so we need to make sure that we're laser focused on investing in our neighborhoods that are what I call our middle neighborhoods that are teetering, that, but for a small investment could be the great neighborhoods that we see all around our community. And so for me, definitely, I think that we as a city have to step up and we have to do more. We've done so much. But there is so much more to do. And I think it is becoming very clear, and this is not a partisan statement either, that the federal government and the state government, we can't rely on them. So we have to think locally here in Columbus and Franklin County, what are we going to do? What kind of city do we want to be, right? And make sure that housing is a key that everyone has access to. So I'm excited to be on council and to work on these issues. But I'll leave it to this. For folks that are skeptics, or folks that think that this is just a moral case, I want to make the business case to you. So I work at Gladden Community House every day, we're a partner with the Community Shelter Board. It costs us on average $2,300 as a community to keep someone in their home. If they get evicted, get into the shelter system, it costs us on average $9,700 to put them back into housing. Just let that sink in for a moment. So if you don't think that this is a true issue from a moral standpoint, let me make the business case to you. That we as a community, we pay for this. And so we have to say to ourselves, do we want folks to be stable and set up for success? Or do we want to continue to be reactionary? But I believe that we can step up to the plate and we can make sure that folks are safe in their homes. So I'm excited about this conversation today. I'm excited about the questions. But very quickly, I think what we can do at the city level, and I think we have demonstrated this in 2018, for the first time in the city's history, we passed a bond package specifically for housing. Only $50 million. That's a drop in the bucket. We need to go back to the voters of Columbus and say, we need more resources here locally to develop more affordable housing, to have the political will to say that we're going to invest in existing housing so that there are private landlords that are in this space, that we can invest in their properties, because it's not about who owns the property, it's about who's in the unit, right? And then also we need to say to folks that we as a city and as a community are going to have a risk mitigation fund so that we are encouraging more private landlords to be in this space. The units that we're losing the fastest of are the single family mom and pop smaller units, right? Not huge apartment complexes. And so we have to make sure that those folks, that everyone is welcome into this affordable housing space. And I want to make sure that we talk about this as well, Madam CEO, because there is the stigma. Affordable housing is not simply subsidized housing. Affordability is a spectrum. I get phone calls all the time at Gladden. And when you think about what all the other social determinants of health are and what else goes into your income, there was a woman who called me, great story. She was formerly addicted to drugs. She has 10 years clean now, got her bachelor's degree. She's working at State Farm. She's making $50,000 a year. That sounds like good money. But she called and she needed help with her rent. Why? Because she's a single mom with 2 kids. And because of the pandemic, childcare costs went up. And after paying childcare costs and after paying for her car, it is a spiraling effect. So this is not simply just folks that are homeless. There's a whole entire spectrum when we talk about affordable housing. And so I think that we are a community and we can step up and make sure that everyone has a safe and quality place to live. And I want to fight every day on city council for that. So thank you guys for having me, and happy to join the discussion.
Well, I'm excited about the work that Nick is doing already, not only in his position at Gladden Community House, which is one of our settlement houses in Columbus, which we're fortunate because not every community has settlement houses. And we're fortunate at Primary One Health to have a partner with our settlement systems. Primary One Health is located in the St. Stephen's, a settlement house building in the Linden area. And then we are right across the parking lot. In fact, it was my intention when I was on council to make sure we built the new building of Primary One Health, then Columbus Neighborhood Health Center, Inc., right across from Central Community House, because there is a need for synergy of health and human services organizations to address all of the needs of our community. So thank you very much, Nick, for the work that you're doing at Gladden, and certainly your work on council and your passion about housing, because you know it firsthand. And as you said, it is a spectrum of housing needs in our community, from those who are homeless all the way up to what we would consider middle income housing needs. With that, I want to ask any of the audience if you have any questions from any one of our presenters today. Please feel free to ask those questions. You can take off your mask to ask the question. But before a question comes up, I also, as was noted, former state senator and the publisher of the Columbus Dayton African American, Ray Miller, is here. We've got the publication, the Columbus Dayton African American. For those who aren't familiar with the publication, it is a news journal, a more substantive view of the issues in the African American community. I write a health article every month, as well as a legislative article every month. But it is a vehicle to share and come up with solutions for our communities of color, specifically African American communities disproportionately being impacted by homelessness, substandard housing, etc. So if there are any questions, Chris, are there any online?
There's just one comment. I appreciate the symposium. It's interesting that you have to make a minimum of $19 an hour to afford a two-bedroom apartment.
That's a huge issue. $19, I think it was $19.83 an hour for a two-bedroom apartment, to afford a two-bedroom apartment. 2.3 2.3 minimum wage jobs in order to afford that two-bedroom apartment. That says a lot, because not many of the people who are struggling with their housing are making that $19.83 an hour. So there's more work for all of us to do. Raising the minimum wage will help us with the housing, but we have to have the housing stock. And one of the issues, while we're waiting on some more questions from the audience, one of the issues we've got to pay attention to, we are so happy that we have Intel coming into Central Ohio. The average wage of those jobs in Central Ohio are going to be $135,000 a year. But what does that mean? It means the price of housing is going to go up, because all of those who have housing, whether they're apartments or single family housing, if we don't have enough housing units, it's going to drive up the cost of those existing housing units. And it's already a seller's market right now. If you're looking for a house, you're going to pay more than it's even advertised at being sold for. If you're in an apartment, it's very difficult to find an apartment that's affordable in Central Ohio. So we've got to do more. Questions?
I have one more that pops up. With violence in our communities and many grandparents raising grandchildren, how do we support those grandparents?
Anyone who wants to respond to that, either on our panel. Sonia, come on up.
So, excuse me. So the question was around how do we support grandparents that are taking custody of children? So CMHA has a kinship initiative. So we work with the Ohio Grandparents Kinship Care, OGKC group, and we also work with Columbus React Team. And first off, we started a conversation. And so what are some of the needs of the residents that the grandparents, but not just grandparents, family members, because it could be an aunt or uncle or anybody that takes on the responsibility of being able to have their custody of their children and of their family. And so we are looking at what our policies are, because most of our policies are around parent relationships. And so we're looking at the policies and see what is step one that we can do to provide access to housing for those individuals. So one pilot that we did is when we were building one of our communities is we designated units of housing to those that received children and agreed for kinship care for parents that were seeking addiction treatment. And so, so that was a relief to those families that stepped up and said that I would be able to support. They were able to go into a CMHA housing unit that had the subsidy to not only to help them get larger units when they need them, but also at a subsidized rate. And I'll tell you about a story that I'm extremely happy about and around kinship. So we had the unfortunate situation where one of our head of households was the mother who had 6 children had passed away. And so when she passed away, normally if there's an adult in the household, the voucher would then go to that adult in the household. And the expectation is that they will continue to provide the housing support for the rest of the children in the household. Well, there wasn't an adult in the household. The nearest adult was a 21-year-old son that wasn't living in the household, but wanted to step up and be able to get custody of the kids. Well, a couple of the children. Come to find out, he was homeless himself. And so at the end of the day, we partnered with Franklin County Children's Services to stay on top of how kinship was going to be assigned. 3 different family members stepped up to be able to support all 6 of the children. And so one of the families already had a voucher. We were able to provide a voucher to the other 2 so that they too otherwise can now, while they're stepping up to provide the support for their family members, also receive subsidized housing. And that son that was 21 years old, that was homeless, since the RISE Center provides supportive services to anyone within Franklin County, we were able to connect him to a community health worker who worked with him for him to not only obtain housing, but he also went to school and helped to navigate that relationship with his siblings. And so it's about, we have to be innovative in these situations and think about, like, what do we have right now? What is it that we can do right now? And what are some of the things? Continue to have the conversation to see what we can do in the future.
Any other questions, Chris?
How can persons without access to the internet get access to information on these great resources on housing?
That's a wonderful question, because, you know, we all assume that everyone has access to the internet. And there are many individuals, not only younger people, but also older adults who don't understand, don't have the technology, don't have the ability financially to get the technology. There are phone numbers for all of these organizations, and Primary One Health will make sure that we put up the phone numbers of each of the organizations that are presented today, so that you can get in contact with them in order to get more information about the programs. Anyone else want to share anything about other ways to get in contact?
Come to the library.
That's a very good suggestion, Sonia. Come to any of the libraries in Central Ohio. Our Columbus Metropolitan Library System has wonderful resources, and you can get online at the libraries. You can do your homework, you can look for jobs, and certainly you can look for housing here at the public library system. Anyone else have any comments or? Yes, go right ahead. You can come up here. The listening viewing audience.
I'm sorry.
Yeah, you have to come here so the rest of the people.
It just got 5 minutes longer. No, I'm not going to take much time, but I am so enormously proud of all of you, but a few people in particular. I'll mention Bo Chilton first, because I have the most to say about him, and trust me, I'm not going to take very much time. We had a major forum. We're both in the same fraternity, Alphas. We're at the second time I've told this story my whole life, and thousands of people at this forum. And there's this one brother behind me, and he's beating politicians up like you wouldn't believe. And he's saying if they would do something, people would know who they are. I mean, he's just going on and on about how terrible all of these political people are. And I didn't know who he was. I turned around and I said, who is this young man that has all of this anger inside of him about political people, right? And so point there with Bo is, if you know something, do something, right? If you know something about an issue or circumstance, whatever happens, do something about it. And so every week when I'm picking up a paper, I see a new award going to Bo Chilton. At Impact, I see a new award in some other capacity that he's serving our community. I'm just so incredibly proud of you, man. You have no idea. When I'm reading the Columbus Foundation giving awards to you and into Impact and your incredible staff, you had tremendous staff. I think we just ought to give them a big old round of applause. Outstanding brother. Outstanding brother. As a young man I don't know as well, second person very quickly, and he would call me, he would send me notes. It's like, can we sit down and talk? And I saw his service over at the Urban League, you know, and said, who are these young people who are doing things? I have a leadership academy, so I'm particularly always looking at the young. So here he is doing some service at the Urban League, young professionals. Am I right about that? Yeah, I thought so. And so here's a tremendous council person whose voice I really haven't heard that much. I've been seeing all of his work for years. First time I've been in an audience, I believe, to hear your voice. And yet I'm receiving all this information from you. Nick Bankston is going to be one of the great elected officials. He already is, if you ask me, in the city of Columbus. So thank you, brother, for the way in which you have prepared yourself and the service that you've given. And your wife, if I'm not mistaken, has also been very active as well. Is that right? Yeah. My wife, we've been married 50 years. And so if I don't say something about my wife, I get beat up when I get home. Third person, and the most important person in the room, as far as I'm concerned, and that is the president of Primary One Health, former state representative, former state senator, former city council person, and yet she's still only 32 years old. How about that? How about that? But again, you know, just in terms of how proud I am this morning, you know, just to sit back for a few minutes. I'm sorry I'm late. I publish a newspaper. People are calling from around the city, around the state, and the country with, did you get my contribution in this edition of the paper that's coming up? So Reverend Tim Aarons, if Reverend Tim Aarons calls, you're going to be on the phone. What, Bill McCoy in Florida, they were calling as I'm trying to get out the door for the last hour of my home, and I'm not that far. I'm in Eastmore, right down the street. But this young lady is one of the great elected officials, former elected officials in the country. And then she just goes right over and takes all of that energy, all of that passion. Boy, I got stories there on let me tell y'all. I mean, I'm just an honest person. You know, they put the state legislature on television, right? And just as a city council and so forth. And I'm sort of a mentor to the senator. And I turned on the television and there she was, and she was given that patented smile as she was speaking. If you're ever in the room and you see her really smile at you and start talking, you know, really proper and everything is going just fine, know that she is mad as hell, just mad as hell, okay? And so here she was wearing them out on the floor of the Ohio Senate. And you know, I'm a guy of protocol and all. And I'm watching her and she gets that little smile and some member is speaking. And then she got kind of quiet and just wore him out, right? It was something to see. Anyhow, great leader of Primary One Health. Again, award-winning organization. And just want you guys to know that I'm thankful. I know a lot of people in this community are. And keep doing what you're doing. Bless you.
Thank you. Thank you very much, Senator. Thank you very much. And at that, if there aren't any other questions, we are going to close today's quarterly community health advocacy breakfast forum. I want to thank Susan Brewer, who is our manager of marketing and development, who's been taking photos and sending them to our intern so she can post them on our social media. Thank everyone for coming out, and certainly thank our listening audience who is joining us through our YouTube channel. We will have our next quarterly breakfast in which month, Chris? We'll post it online. I believe it's in April. We'll post it online and with the next topic and where we're going to be physically located. Thank you all and have a wonderful Saturday.